So we used Delphi consensus, which is often used and has previously been used for making Dravet syndrome recommendations. It's more of an expert opinion consensus that we will use when overall evidence is lacking. And so we started off with a multidisciplinary international steering committee with membership throughout the globe. And we wanted to make sure that it consisted of neurologists, psychologists, patient advocacy group representatives. So again, it was multidisciplinary. And then based on the current evidence and our experience, we put together a series of statements regarding, again, how this initial consultation should happen. Then we put together our panel of experts. And again, we wanted to have global multidisciplinary representation. We sent the questions out and we had 2 voting rounds. In the first voting round, the experts were to determine whether they agreed or disagreed with the statement using a 1 to 9 on a Likert scale. If there was high consensus, so 75% gave it at least a 7 and the overall score was 8, then that statement just was finalized and didn't require a second round of voting. If there was good consensus, so either 75% gave it a 7 or the overall average was 8, then we might reformulate it and put it through to the second. And then when we had the second round of voting, by that point, there were only 4 statements. So in the first round of voting, when the experts were determining how much they agreed, they could include comments. The second time they couldn't, they just needed to vote without comments. And then from that, we were able to formulate basically 34 statements.